Hi, I'm Carissa Cousins, and I want to thank you for coming today to listen about the Universal Prenatal Screening Project. I'm directing the Universal Prenatal Screening Project. It's an IHN-funded grant that we received. It's kind of hard to talk about something with the word universal in it in 5 minutes, so I'm going to go off on a little bit of a different tangent. I want to talk about leprosy. So leprosy is a disease that's been around for thousands and thousands of years. Leprosy was originally thought to be caused by unsanitary conditions, a poor diet. It was thought that people who were impure would get leprosy. People tried to hide their disease. They would cover themselves up. They would hide from services. Sometimes it would be legal people that would try and come and take these people away. Sometimes it was social services that would come and try and take these people away. So these people were hiding. They were trying to evade being caught. They were often shamed and ostracized and stigmatized. They were often pulled apart from their families and placed in sanatoriums and isolated from their communities, and they were alone. So this is a disease that's been around for thousands of years, and it wasn't until the late 1800s that there was a cause for it, and it was discovered that it was Mycobacterium leprae that caused this. And it wasn't until the 1940s that there was found a cure for this. So people with substance use issues, addictions, and mental health concerns face many of the same problems that the people with leprosy used to face. And we need to change our culture from that kind of more primitive thinking of ostracizing and shaming to one of accepting and understanding. So unfortunately, like for leprosy, there is no cure, and there is no one causative agent. We need to understand that addictions and substance use disorders, depression, they aren't choices that people make. People don't choose to be depressed or to use meth or be addicted to heroin. These aren't choices. Addictions and mental health conditions are brain diseases, and we need to think of them just like we think of any other kind of medical condition. So what we're doing with the Prenatal Screening Project is we're educating people on these illnesses and how to deal with these illnesses. We're trying to open the door to these conversations, these difficult conversations, so that people can feel comfortable talking about it. We don't want them to hide like the people with leprosy had to hide and be ashamed. We want people in our community, our medical providers, our nurses, our social workers to feel comfortable talking about substance use disorders, mental health, domestic violence. We want people to ask these tough questions and listen to the answers and support these people with non-judgment and empathy. So in short, through the Universal Prenatal Screening Project, what we're doing is we're using an evidence-based standardized questionnaire called the 5 Ps, and it asks questions about substance use, mental health concerns, domestic violence, and tobacco use. We're working then with a woman's own desire to make those changes in her life. We know that we can't tell someone to just stop using or to just be happy. We know that we can't direct people how to change these behaviors. We need to work with a woman's own motivation to make these changes. So we're using something called a brief intervention and some motivational interviewing skills. So we're taking that shaming and blaming away from issues like substance use and mental health concerns. And we're working with the women to find their own motivation to make these changes. And if a woman is willing to make that change and she's ready to make that change, then we're connecting her with those services. And we're doing that through warm handoffs through the appropriate providers. So really what we want through this project is for people in our community, our healthcare providers, to be able to say to a woman, hey, I understand it's tough. I'm here for you, and we can get through this together. Thank you.